I'm Dr. Forwith. I am with Advanced ENT Allergy, and I've been in this practice for 20 plus years. And I love what I do. I started into medicine at the age of about 13. I had a family tragedy. My father was unfortunately hit in the face with a chainsaw that he was working with. And when I was growing up, my dad was the absolute most important person in my life. And I was there, I saw it, and when he turned around, it was blood everywhere. My mom drove him to the hospital a million miles an hour, and he survived, but barely. But he had a lot of facial trauma, and to the fact where he wouldn't even let us see him for a couple of weeks. But there was a surgeon named Dr. Welsh, and he came in on a Sunday evening when this happened, basically saved my dad's life. And that's been my inspiration for why I got into this field. One of the things that probably sets me apart from a lot of physicians is I absolutely just love to teach. So I love to teach residents, I love to teach physicians who are in training, but I also love to teach my patients. Sometimes there's not a lot you can do about what's going on, but understanding what's going on and how it's going on can really make an impact, not just on the decisions that are made in the care, but in the follow-through as well. So while I love to fix things and I love to make it better, sometimes just understanding why things are going on can really help a patient to deal with it. So I've been practicing in this practice for quite a while. I love being with Advanced ENT and Allergy for a number of reasons, one of which is we have a large physician population. We have a lot of providers, and they're all very, very talented, and so we get an opportunity to learn from one another. We also get a chance to share in the subspecialty area. So while it's great to be a general ENT at my stage in my career, I very much subspecialize, and I appreciate the interaction that we have to really get the patient to the person who's going to be able to deal with it the best. One of the things that I'm very proud of is the continued effort to stay on the cutting edge of things. So, for instance, I was one of the first 25 surgeons in the world to practice transoral thyroid surgery, where we can go underneath the lip and get to the thyroid and never leave a scar on the outside. I'm also very proud of the development of radiofrequency ablation. I was one of the first 10 people in the country to offer this. I actually had to go to Brazil to learn to do it, but it's a great non-surgical technique that offers patients an alternative to surgery when oftentimes they're told that there is no alternative to surgery. To people who know me really well, this isn't an unknown, but I tend to love the things that I do, and I tend to get deeply involved in them. And so my wife and my friends will make fun of me because when I take up something new, I dive right in. A lot of times that lasts, and sometimes it doesn't. So for example, one of my biggest hobbies is skiing, and I water ski and I snow ski, and I absolutely love it. So when a patient comes in to see me, what I want them to walk out the door with is an understanding of where we are and what the plans are. If I can help them, I want them to understand the steps that we're going to go through in order to make things better. And if I can't help them, I want them to understand what their next steps might be.